Hi, I'm Dr. John Young with Foundational Health Center here in Largo, Florida, with my nurse practitioner, Alex. And today we're going to be talking about, it's a hard word, compartmentalizing medicine.
Yes.
I saw a patient today, and earlier in the week, he had gone to see his doctor, and his doctor said, "You're low in testosterone, you've got type 2 diabetes, you've got fatigue, your adrenals aren't that great, you have high blood pressure." And he was going to leave that office with about 5 or 6 prescriptions. And he's like, "John, he's killing me." And so he wanted me to look at it. And I said, yes, as a doctor, that's how I practiced years ago. For every complaint, here's a drug. But what Alex and I look at is we look at the whole person, kind of an odd idea. And I said, you know, in looking at your labs and what you're telling me, first of all, you need more protein. You take in very little protein. If you don't have enough protein, you can't make nitric oxide, which has to do with high blood pressure. You can't lower insulin, which is type 2 diabetes, insulin resistance. Number 3, you're fatigued and losing your hair, probably because low iron. You don't take in enough protein in your diet to hold on to iron. Yes, your testosterone is low. I'm going to give you some testosterone to get you feeling better. But let's just do these 2 things, and I've done it for years. And 99% of our patients come back saying, "John, I feel so much better." That is why we are in the practice of medicine we do.
Yep. Yeah. And we don't just see patients, let's say, from the head down or the head up. We hear this all the time. I have so many patients that come to me and say, "Well, but my doctor said that I can only have one complaint today." She said, "Well, but I have a hair loss and palpitations and my blood pressure." No. Stop it. You have too many complaints. You can only tell me about one, and we'll go about that one and we'll fix about that one. So that's where they have all these referrals. So she gets out of the office with maybe like 2 different referrals. She goes, one is for the cardiologist, the other one is for endocrinologist, the other one is to do da. So you end up coming out of the office with all these prescriptions, and you have to see all these doctors, and they don't talk to each other. That's the other thing. So and they get overwhelmed, Dr. Young. That's the other thing that I hear my patients saying. They're like, "My doctor doesn't have the time." They get too overwhelmed when I bring up all these things, and they don't know how to help us. And because the reason why that happens is because the way we think, we think as a whole. You can tell us 20 different things, and we can put it all together and come up with a plan of action that you can do immediately. We don't have to send you to 10 different specialists to figure out what the problem is.
Right. And so that's what we see happening in medicine, is because it is very drug oriented. And listen, we love the drugs.
Yep.
If you've got a bad infection,
Yep.
we love antibiotics.
Absolutely.
Stroke,
Yep.
go to the hospital. But for 90% of what we're seeing with all these people on polypharmacy, here in St. Petersburg, Florida, did a study a few years ago. The average 65-year-old is on 23 prescription medications.
Absolutely.
We have lost the ability to look at the patient as a whole and figure out what's going on physiologically, even genetically, biochemically. And when you do that, it is harder.
Yes.
The other thing is you have to also let the patient talk.
Yes.
And you said something the other day about if they talk.
Yeah, if you talk, and I've been working with you, long enough, and I learned everything that I know from you. And I always remember when I first started here, he used to tell me, if you let the patient talk long enough, they'll tell you what the problem is. And I use that technique so many times because we have the time to do that with our patients. So sometimes we go off track a little bit, and they just remember something, and they tell you something, that little detail they were trying to find out what the problem is, and you're like, "Oh, this is what the problem, you just told me what the problem is."
That's why our visits are not 3 to 5 minutes.
Yes.
20 is probably the average.
Yes.
I think the best example is that lady that I'd worked with for 2 years to control her diabetes.
Mm-hmm.
And I'm thinking, my plan has been great.
Right.
And I could never control her blood sugars. And as she was leaving my office that day, someone had left the newspaper there. And it was open to a food store, I think it was Publix.
Uh-huh.
And it said their mini watermelons were on sale for $1 a watermelon.
Yeah.
And she said, John, those mini watermelons, they're loaded with lycopene. That is such a great mineral that we need in our body, vitamin. I said, so do you eat one of those every day? Every single day for years. That's why your blood sugar was never under control. You eat one of those every day.
It's loaded with sugar.
I found that out after 2 years.
Yes.
And, and she never thought to tell me. But eventually, even if it's 2 years, they tell you what's wrong, and we're able to really get our diabetes under control.
And you can't not accomplish that with a 5-minute visit, with an 8-minute visit. That's how I was trained. I was taught to get in and out of the office. Basically, I had one professor that said, well, you need to just hurry up. I'm like, but I'm taking 10 minutes. She's like, this is too long. You need to take 5 minutes. So what you do, she said, you just write the scripts before you go in the room, so that way you just can speed it up things. So you can't really solve any problems that way. It's very, very difficult. And you're going to have a doctor that's going to be super stressed out too. He can't help you.
So I think we hear from you all out there that yes, you get very frustrated with your medical doctors.
Yeah.
And we feel your pain, you might say. They have to see them very, you have to run them through quickly because of insurance reimbursement.
Right.
But I think most of the doctors out there are very good for a one problem deal,
Yes.
an acute problem. Yes. But if you're struggling with chronic disease, diabetes, hypertension, strokes, cancers, any of these chronic conditions, you may want to be checking for a more holistic or a
Yes.
doctor that knows not just that we're going to give you some vitamins instead of these drugs,
Right.
but knows physiology,
Yeah.
how God caused the body to work,
Yeah.
biochemistry, the chemical aspect of it, and the genetics.
Yeah.
Those are going to be key, because if those doctors know that, they're going to be looking at you completely different. And when you do that, it's amazing how people do and will get better.
Yeah.